Thank you, Secretary of State. So I would add that we're absolutely not hoping not to have a second wave, and that is one of the reasons why we are being so careful about unlocking social distancing one piece at a time, because we absolutely don't want this to get out of control again. However, is it right and proper to prepare for emergencies? Is it right and proper to put ourselves in a good position to be able to deal with an upsurge of cases? Absolutely. And let me emphasise a couple of things here. One is that maybe people are just hoping and praying that this virus will just go away, as indeed I hope and pray it will. But the reality is that certainly until we get a vaccine, and only if we get a vaccine that is really capable of suppressing disease levels, will we ever be what we would call kind of out of this. And so from that perspective, we may have to live and learn to live with this virus in the long term, and certainly for many months to come, if not several years. A vaccine may change that, but we can't be sure we will get a vaccine. The other thing to say is that this virus is a new virus. We don't fully understand it. We don't understand something called seasonality. And one of the things that's very clear, for example, with flu viruses, is that they come in our cold winters, and the levels of transmission and circulation decline over the summer months. Now, the data we have on other coronaviruses, we've looked at very carefully, and it is not clear that these coronaviruses are as seasonal as influenza. But there may be an element of seasonality, and it may well be that the autumn and winter conditions provide a better environment for the virus to then do its work again. So we have to be very cautious about that and plan for these kind of healthcare surges that we hope we don't need, but we want to be ready for them if they happen. Thank you.
Very good, and thank you, James, for your question. We'll open it up to the media now, and I think we've got Fergus Walsh first from the BBC. Fergus, over to you.
Thank you. You've just added loss of taste and smell as a key symptom for coronavirus. France advised people back in March that if they lost taste or smell, that they should self-isolate. Hasn't the UK been very slow to act?
Jonathan, I think that's probably one for you as...
Yes, thank you, Fergus. We've been very careful about looking at the data on anosmia and looking to see if adding it to the case definition would change something in terms of what we could practically do. Now, I do understand, and you're absolutely right, that anosmia has been recognised for some time now as a possible symptom of Covid-19. But if you unpick that a bit further, one of the first questions is, how often does anosmia come really early in the illness? That's the first question, versus coming later on in the illness when there are many other symptoms that are evident, particularly cough and fever, which are absolutely the most prominent. The next point is, how often does anosmia occur on its own in the absence of other symptoms? And the answer seems to be very rarely indeed. And so from that perspective, what we've had to do is go through all of the possible symptoms of COVID-19. And, other than fever and cough, the WHO list includes tiredness, aches and pains, sore throat, diarrhea, conjunctivitis, headache, skin rash, even loss of speech or movement is something that the WHO put on there. So what we have had to do is do some very careful analysis behind the scenes to try and work out, when looking at the whole range of symptoms again, which of those it might be useful or important to add in terms of picking patients up and improving the very simple and easy to remember symptom cluster we had already of cough and fever. And that's why we have taken our time in this country, because we wanted to do that, again, painstaking and very careful analysis before we jumped to any conclusions. And even if it was bond or obvious that anosmia was part of this, we wanted to be sure that adding it to cough and fever, as opposed to just listing it, adding it in formally into our definition, was the right thing to do. And based on advice from NervTag, we have made that decision.
Fergus, did you want to come back on anything?
Professor Tim Spector estimates that between 100 and 200,000 cases of COVID-19 may have been missed by the failure to include this earlier. How many cases of COVID-19 do you think have been missed as a result of not including this earlier on?
I mean, I don't have those figures to my fingertips. I'm not sure anyone's, other than Professor Spector, has tried to make those kind of estimates. What I can tell you is that from the Public Health England data set called the FF100, the first few hundred cases, there are actually 229 cases in there, all laboratory confirmed COVID, all of whom have been studied in considerable detail, and 0.44% reported anosmia on its own as a symptom. So the point about anosmia is that it doesn't always come as the first symptom, and even if it does, it is followed